All right, welcome to Unlocked Investor. I'm your host, Ian Robertson, and today I'm joined by Angela Dotson. Angela is the CEO of Empress Medical and BlakeBrooke Ventures. With over 20 years in MedTech, she has helped deliver several successful exits and received the 2023 Outstanding Leadership Award from Health 2.0. Angela, welcome.
Hi, thanks for having me today.
Yeah, absolutely. I'm really excited to have this conversation today and dive deep into your extensive experience with MedTech investments, especially. But first, I want to go back to the beginning of your career. How did you get into MedTech to begin with? And just walk us through your career progression from there.
Oh wow! So I'll try to make this as short as I can because it's quite extensive. But I got into the med tech space, I guess, close to 23 years now. It doesn't seem like it has been that long. Time has surely flown. But I knew that I wanted to do something in the medical field. Wasn't for sure exactly what I wanted to do. And I got involved with some med device companies early on that kind of pulled me in. And my first medical device job was with a company called KCI in therapeutic support services. So I started out in sales, and then my first surgical sales, I moved from then and got into the surgical sales area and fell in love with that and never left. And so that was with AGA Medical with the implants or vascular plug. I still consider that my baby. Loved that team. Peter Van Hour, I kind of give him credit for really giving me the opportunity of a lifetime because of that opportunity. It set my career path on what has been nothing short of just a fantastic journey. And yeah, it was a startup company. I fell in love with the startup world. And what a lot of people may or may not know that's listening to you in the med tech startup world, typically the goal is to get acquired by a larger company. And as such, that means that you will ultimately either go to work for that company or you'll find yourself moving on and moving to another company. And for me, I chose the path of I wanted to stay in the startup world. So I kind of moved from AGA to several different startup companies, everything from the ENT space to the vascular space, peripheral vascular space. I've been in interventional cardiology. And then a couple of years ago, I basically went from sales into management and then into the executive side of medtech. And I found myself really wanting to start investing in the medtech space because it's something that I know so well and that I feel comfortable with. I couldn't tell you anything about stocks. So, anybody that comes to me and asks me about a stock, I'm like, I have no idea. But medtech, I can tell you everything about that. And so I started my own company, BlakeBrooke Ventures. It was named after my two girls, Audrey Blake, who passed away shortly after birth, and my second daughter, Lainey Brooke. Something is just like a legacy that I could kind of build upon and leave for them one day. And I started investing, which is how I came to know you. And then with that, things kind of branched out from there. I found myself working with one of the physicians that I worked with, helping to bring one of his technologies about 15 years ago, Vascular Insights, with the Clairvein device. And he had a couple of different projects that he was working on that he was needing help getting funding and things like that. And so I came on board, and Empress Medical, as you mentioned earlier, is one of his companies. So I'm acting as the CEO there now, is one of them, but I'm also his VP of Business Development for several of his other projects, as well as the U.S. General Manager for those projects as well. And as such, not only have I, been an avid investor in these technologies, but also worked with bringing a lot of investors into the medtech space, a lot of investors connecting them with you so that they could be able to, enjoy this opportunity as well. And so my career has been one that really has evolved quite significantly, and probably in the past 4 years at a very rapid pace that even I could not have even, ever dreamed of it being. But it's been an amazing journey. I've loved every second of it. And most of all, have been a part of some amazing technologies that have truly been transformational in the quality of patient success in this country. So I'm proud of that.
That's amazing. And now, did you go to college?
I did. Yeah. So I went to Radford University, Radford, Virginia. For those folks that are familiar with football, and it's close to Virginia Tech, the Hokies. So technically, I would be a Hokie fan. We didn't really have a football team at that time, still don't. But yeah, I went to Radford University. I majored in organizational communications with a background in sociology, believe it or not, and which I know is kind of weird given that I went into the sales and the business aspect. But kind of found that you kind of need to know how to negotiate and communicate and all this stuff. So it actually was a pretty good career path as far as what I decided to major in.
So, okay, that is interesting. Now, like I'm in the sales world as well, and I know in order to sell anything effectively, you have to understand it
Mm-hmm.
very in depth. Like you have to be able to answer questions that the normal person just wouldn't have any clue about. And so, how not having a medical background at all, like how did you absorb all that information or learn it quickly enough to be able to be effective there in sales?
So good question. So one thing is, I think it has to be something that you're very interested in. The medical world is not for everybody, but it has to be something that you are really interested in, you want to learn about, and with that type of passion, you're able, I feel like, to be able to kind of bring in the information a little bit more, quickly than somebody that just hates it. So that helps a whole lot. But for me, my love for medicine started at a very early age. I was very close to my family on my mother's side, and her youngest brother, was involved in a horrific car accident whenever he was 17, and he became a quadriplegic. And so my family spent a lot of time in and out of UVA Medical Center, Woodrow Wilson Rehabilitation Center, and so at a very early age of like 7 years old. I was around a lot of that, and it kind of drove my passion of wanting to learn as much as I could about not only his condition, but what my family was having to face, because we lived in a very rural area at that time, where even the doctors and nurses in our rural community didn't quite understand what it meant to be a quadriplegic, how to really care for a quadriplegic. And so all of that kind of came upon my family. And that was a big driving force. Fast forward to as I got into the medical device industry, it helped with some of the organizations that offered a lot of training with cadaver training. So, I've had the opportunity to experiment on pigs. I can remember working for a Clarent, which was later acquired by Johnson and Johnson, and going out. It was the first time I ever conducted anything on an actual cadaver head. It was quite interesting, a actual person's head. And so, that allowed me to hone in on some skills of really understanding anatomy a little bit more. But again, I think, it was that passion that was driving it all along, to be able to learn. And then just the opportunity for me, every time that I was around a physician or a nurse, or anybody that could basically teach me, I was like a sponge. I absorbed so much. I took every opportunity to learn, and I'm still learning. I still do that. I think it's very important, no matter where you are in life in your career, to always surround yourself with people who are far smarter than you, that really have done it. I don't believe in reinventing the wheel. I just believe in, you know, learning from other people that have been successful, people who know their stuff, and then honing that to the way that it best fits yourself. And so that's kind of how I did it. There's really no magic to it. It's just really being a sponge and having a passion for it.
Yeah, absolutely. And I mean, like today, now your most of your conversations, I assume, and correct me if I'm wrong, but I assume most of your conversations are with doctors. So like you're holding your own on these more in-depth conversations, right?
Yeah, it's very interesting because obviously whenever I started out years ago in sales, your conversation's a lot different. You're talking about your product, you're talking about how it can help the patient that they're treating. And then when you're in sales, you're in the operating room or the cath lab alongside the physician. And especially when you start out and you're very young, there's such a pride in that. Like, it's so exciting to be in that atmosphere that you normally would never get to be in, otherwise. But it's funny how my conversations have evolved now with the positions that I'm in now, because although we still talk about, a lot heavily on our technologies and what they are going to mean to the medical world in general, all across the globe. I'm also finding myself talking about funding and fundraising. And, I was telling someone the other day, I was like, if you would have asked me, even 6 years ago, like, would you ever be talking to a physician about funding or talking to anybody about funding? I'm like, no. I mean, I can't even tell you about the stock market, And so it's funny how many ways that you have to really become as much of an expert as you can, to make your business successful. And so my conversations now are just about so many things surrounding everything from the company to the technology, to the fundraising piece of it and beyond.
And so what was, if you can like pinpoint it down, like what was the turning point in your career where you were able to make that pivot, or where you started to make that pivot from just selling a product to now going above and beyond, and now on the other side fundraising and helping in that way as well for the companies?
Yeah. So for me, it was becoming a mom. Once my daughter was born, I knew that I wanted to kind of pivot away from being out and being in the OR or the cath lab on a daily basis, and having a little bit more control of my day to day schedule. Because whenever you're in sales especially if you're a startup company, um, even the physician, they only dictate their schedules to a certain degree, because cases get delayed, and the next thing you're still in the OR waiting for your procedure to start 3 hours later. So there was really no way that I could kind of predict, okay, what time am I actually going to be home? And with her being my only child, it was very important to me to be able to be present. So that was really my driving force, was her. And um, and then in addition to that too, it was also a dream of mine that I wanted to be able to invest in the medtech space one day. But I just never knew how to do it, to be quite honest with you. Like, I knew all these other people that I worked with all these years, like CEOs and VPs and all these executive people, and obviously they were doing very well. And I'm sitting here thinking, there's no way that they're just being able to do all this stuff, just on the salaries that they're making. Not that they're not making great salaries, but what's their secret? And so I got the best advice that I was ever given, by a really good mentor of mine. His name's, I'm sure he wouldn't mind me mentioning his name, Gary McCord. He's been very successful in the med tech space. But I just asked him one time, I was like, what I want to be successful. Like, I want to be able to retire out very happy one day. So what do I need to do? And his words to me was like, Angie, he's like, your salary is what's going to pay your bills. He's like, but investing is what's going to build your wealth. You need to start investing. And I said, okay, then will you kind of take me under your wing, kind of be my mentor? Because I have no clue what I'm doing here. And so he's like, sure. So he introduced me to some med tech opportunities that he thought that I would really be interested in. Some things that he himself was invested in. And again, I think for me, that's where it's important. As I said, I surround myself with successful people and kind of see, okay, what are they investing in? What have they done? What's their success been like with companies that they have invested in prior? And if they have a pretty good track record, or they obviously are very successful, I'm going to pay attention to what they're suggesting to me. So he gave me some opportunities. I looked at them. They made good sense, and I started investing in it. And but then I was looking at, well, how am I going to invest in all this stuff? And I knew that I had my 401k. COVID kind of hit, and I was seeing my 401k literally like tank thousands upon thousands of dollars very quickly. And I'm like, whoa, okay, I want to have a little bit more control over this than just sitting and watching it. And so I was talking to a couple of my colleagues that I knew also invested. And I'm like, do you all invest using your 401k? And they're like, yeah. So they had kind of gave me some information. I found Madison Trust as one of the few that I was vetting out. And, once I met with you guys, it just felt like the best fit for me. And then that was able to open up a lot more doors for me from the investing side. And I just kind of felt like that was where I needed to focus during that time. So that also drove the pivot. So a couple of different events in my life around the year 2020 2021 timeframe that really made that shift. My daughter, the conversation with Gary, and then meeting you guys. So it was kind of like a trifecta thing going on there.
Wow. Yeah. I mean, that makes sense. Like there's always a driving force behind the scenes that's like causing your intentionality, and then it's actually just taking action. And I think most people don't take any action. Like they'll think something and then they just let the thought go, and they don't do anything about it. Would you say that, like, just to try and find maybe a skill that maybe you have that other people don't have, or that they could work on, do you think it's your confidence? Do you think it's your experience with communication skills, like being able to ask the right questions? Like if you could just point to a skill maybe that you have, or that you feel like you have a strength that gave you that ability to take action.
You mean to start investing, like to get into the investment side of it?
To
Or
Yeah, I mean, like to have even just to have conversations like with the people that you know are successful. Like everybody, really, without, maybe they don't even realize it. Like you're surrounded in some capacity by successful people,
yeah.
but nothing happens from it. So like being able to take the action of having the conversations with the successful people, which allowed you to then start investing. Like, is it just your communication skills? Is it your confidence? Is it something else?
I think it's a little bit of it all, to be quite honest with you. I think it's number one, identifying what your personal growth goals are. What do you want to do? Some people don't have a clue what they want to do. For me, I just got to a point, and more so, it kicked into gear after I became a mom. Of this is what I want to do. Like I don't want to be doing just sales my entire life. I don't, these are certain aspects about my career and certain milestones that I want to reach. So that was number one. And then number two, I think as far as I think you do have to have a little bit of confidence. I mean, you need to feel comfortable. At some point, you have to decide in your life, okay, you know what? Like, I see all these other people doing these things, and I know that I'm smart. I am very, willing to do what it takes to get me to the next level. I just don't know what I need to do to get me there. So at some point, you've got to figure that out and say, all right, well, one of the first steps is I need to ask. I need to ask somebody. And what better way to ask somebody than somebody that you already know, that you have some sort of relationship with? So you have to, take out, if there's ego, if you want to say that, and just say, you know what, like, I don't know what I don't know. Help me know it so that I can be successful too. And most people want to see other people be successful. They like being able to share their pearls of wisdom. And I'm so grateful, for the mentors that, I've met along the way that have, been like, yeah, absolutely. I'll tell you what I'm doing. I'll, give you the pathway to find your path as well. And so it starts there. You got to have, I wouldn't even say communication is as much about it as you just need to have the want and the desire to want more for yourself and your personal growth.
Awesome. Makes a lot of sense. Okay, so now to really like dive into med tech, like
Mhm.
how, first off, you have the background, like med tech sales. So when you first started to invest or look into investing, you sort of knew what you were looking at. Maybe you didn't know anything about investing itself, but you knew if the product made sense, if it seemed like it was going to go somewhere. So like for somebody maybe that you're talking to, a potential investor, for a certain product, like from their eyes, how do they look at it and recognize it as it having potential, or like what are they looking at to vet an investment like this?
Yeah. Well, so whenever I first started years ago, and it's been a learning process, and so I guess I, like anybody else, I've had a couple of pitfalls along the way early on of just missteps. So I've kind of learned now what to avoid, what to look for, what to avoid. Um, number one, I think, is you want to always make sure that you're doing your due diligence, even if it's somebody that you know and somebody that you respect that's coming to you saying, "Hey, I've got this wonderful opportunity. This physician is, created this amazing thing." You want to do your due diligence in that you want to see what that technology is about. What space is that technology in? Like, is it in oncology? Is it in vascular surgery? Learn as much about the procedure or whatever it's trying to do. Try to make yourself as much of an expert in that field as possible. And if that means reaching out to a doctor, and ask, say, I would like to talk to some physicians about this. I would like to talk to some physicians that are not necessarily, in with the company. They're not a clinical advisor to the company. They have nothing, but can you link me with some physicians that I can ask some questions about this and get their thoughts on it? I highly recommend to do that. You also want to look at the leadership team. You want to see what successes that the physician has had in the past. Is this their very first invention that they've made? If it's other inventions that they've done, what has been the success of those inventions? You want to understand what their plan is. If it is a seed round, which is the most riskiest, most people would say it's the riskiest part of an investment. You might want to wait till it gets a little bit out of that seed round. If you are a first time investor, wait till it gets to like a Series A where they are a little bit more stable of a company. The leadership team is crucial. You want to know that everybody that's on the team is very well experienced. I would say that you want to understand what the physician's role is in the company. It has been my experience that physicians who are CEOs can do more damage than not to their company because it's their baby, right? And so a lot of times they can't look at things from an independent mindset. They're looking, no matter how much that they try to take the emotion out of decisions, it's hard for them to do because it's their baby. So I would tend to make sure that, it's fine if the physician is involved, but that's why it's so important to look at the team that they have around them and understand, that team is very diversified and that the physician has input, sure, but they have strong leadership and people on their board that can push back to protect the investor's interest. Okay. So that's very important. Um, and overall, just, you're going to assume some risk. You have to be somebody that's okay with risk. So of course you don't want somebody who, if they're looking at investing $100,000 into a technology that they're literally having to scrape every single dime, to make that investment work.
Right.
You want to be able to be able to have some risk and be okay if something should not go well.
Okay, so now let's like break down the timeline for one of these investments. So a physician or somebody has an idea.
Mhm.
It's going to be an invention. How long from that point usually does it take for them to maybe build out a team, build out a prototype? like where along the line? Because you mentioned the seed round. Like when is it that investors are coming along for the ride throughout that?
So it varies. Uh, that's a great question. It's very complex, to be quite honest, but it varies. So again, it comes down to what's the goal of the ultimate goal. Like there's some technologies that come out and their ultimate goal is to get FDA approval and then actually be a full funded company, of where they want to be out in the market for an additional 5 years to, really build out their sales and then try to get an acquisition. Okay. If a company if that's their mindset, then, I mean, from an investor standpoint, you could be looking at being in an investment, upwards to 10 years, maybe, which is a long time. Okay. Um, and then as far as like a seed round with that, a lot of times the majority of companies will start taking investors in during that seed round. And that seed round begins whenever they have the idea and they're just starting out. And that's the reason it's the most risky, right? Because if you're coming in a seed round, sometimes you're funding them doing their first in human clinical trials. And if they're doing first in human clinical trials, then you could find out that you're not being successful, and it could end right there. And then the investors that have came in have just lost their money. On the flip side of that, you could have a company that is like Dr. Tao's, for example, and it's one of the reasons why I've really enjoyed working with him. You can have a startup that's not their goal. Their goal is frankly to get to through FDA approval, do a limited market launch, and get an acquisition. Okay. And with that, you're looking at maybe 5 years or less, which is ideal for investors. Like for our scenario at whether it's Portal or Empress or our most recent Distal, Dr. Tao's model is very different. He doesn't start taking any investors' money until after the first in human clinical trials are done. He funds it all himself. And then after he has proven that he's got the technology, it works, we're good to go, and all of that, upfront risk is kind of been mitigated, then he'll start a company and then he'll start bringing investors in, and they come in at a Series A. So it's a lot of that upfront risk has already been reduced. And then by the time that the investors come in, they're looking at around a 2 to 3 year before they could expect an exit. And that's a big deal for investors. So it just kind of varies on what the company's plans are. And again, I think that that's also where the leadership team's experience comes in, is, and being able to see what their previous successes have looked like in the past of taking all that into consideration for a potential investor.
Wow. Okay. And so Dr. Tao, we'll talk about him just briefly. Like it sounds like he's a very experienced physician. Like he knows what he's doing, but like there's a large element to this that is business. Like there's a medical component. There has to be. That's obvious, but there's also a large business component to it, from just operationally, like how to actually build it out, manufacture, then go through, raising money and all these other different components. Like before he starts raising money, what's happening? Like how does he just have that experience to like know how to do all of the different bits and pieces, or does he have a team at that point as well?
No. So yes, so you have to have a team. You have to build out your team early on. And with Dr. Tao, we have an amazing team that has pretty much been a part. I mean, he has 7 previous exits. Okay, 7. So to say that he's experienced, yes, he's very experienced. And so, I think that he would tell you that, there's been some outside of those 7 that haven't been successful. I mean, it hasn't been a lot, but there has been, and those were lessons learned. That's why it was important to make sure that you have the right team in place, everything from, quality, to regulatory, the right engineers, to understand the process of, what the FDA is going to expect, to be able to engage in those type of conversations, as early as possible. So yes, so all of that, the team is built out early on from day one to start getting to this point. And, any point along the way, there could be issues that could, you know, say, okay, well, this isn't going to work. You know, we tried our best, but you know, it's time to give up on it. But for the most part, if you have the right team and they can move these projects along, everybody knows what their role is. They work together like a well-oiled machine. That's what you want, because you don't have the time to micromanage, you know, every aspect of the business. So you really need to have a team in place that is well experienced and knows what they need to do, and they know how to do it without having someone to micromanage that process.
Mhm. That makes sense. So, how that, I guess maybe can you share a product, a MedTech device or product that failed? Like throughout your career, I'm sure you've seen something go awry. So can you share maybe one instance where that occurred and maybe what the issues were in that, like without getting too technical?
Yeah, absolutely. It was the very first investment I ever made, and I considered it my baby. And it was actually, I had invested in it before 2020. It was before I ever, you know, and this is why I say it's important, especially if you're a first time investor, you know, to reach out, do your due diligence, you know, talk to people. Because I had gotten approached by this gentleman on LinkedIn, and you know, like, we have this great technology. You know, we see that you're, you know, at that time I can't remember what company I was working for, but it was in the vascular world. And you know, we would love to have your thoughts on it, and would love to have you join us as an investor. So I was very young, very not knowing anything about anything at that point. But I look at the technology. The technology made total sense to me. Okay. It was an early bleed detector for large bore procedures, which is a big deal. There's a lot of bleeding complications, and I knew this, a lot of bleeding complications that happens during the process of like AAAs and things like that. That really pose a great risk to not only the patient, but it's a burden to the hospital system, and the physician as well. So I'm like, this totally makes sense. If you have a technology that can detect an early bleed, like as soon as it happens, and alert the doctor right then, they can stop, go dress the bleed, and take care of it instead of waiting until that patient is out of surgery and in the recovery room. And then they find out they've got a bleed when it's way too late to catch it early. And now they've got a major complication on their hands. So I invested in that technology. Problem is that they did not have reimbursement. Now, this is a soapbox, and I will not get on it for the sake of time, but reimbursement is a soapbox of mine. This is another very important thing for investors to consider whenever they're looking at technologies. To need to understand, is there a reimbursement pathway, and what does that pathway look like? Is it feasible? Because I don't care what technology it is, how great it is, if the physicians and the hospital systems cannot get paid, it's going to be very difficult to have a successful outcome.
Can I
And
stop you there? Can you explain reimbursement?
so
Like, what does that
reimbursement,
mean?
so okay, sorry. So reimbursement basically is your insurance, right? So is it going to be something that the hospital can bill for that the insurance will reimburse it for? Okay. And without getting down a rabbit hole, basically, in a nutshell, what your viewers need to understand about reimbursement is every single procedure, as far as from the hospital standpoint goes, is assigned what's called a CPT code. Okay. And that CPT code will either listed on your insurance's policy as a covered procedure or a covered technology, or it's not. And so for young startup companies that are coming out, they need to know, okay, is my technology going to be able to fall under a CPT code that's already out there, that's already covered, or are we going to have to go and try to submit to get a new CPT code for us? And if they have to submit for a new CPT code, that process can take a very long time. And there's no guarantee that even if they are granted a CPT code, that the insurance companies will agree to add it onto their policy. So best case scenario is if a new technology is coming out, they can fall under an already existing CPT code that your insurance provider already recognizes and already reimburses for. Okay.
Now, just to stop there also and dive just a little bit into it, the say there's a product with a CPT code that already exists, so they can line into that. I would assume another big point there is also the pricing. Like, how much is the insurance actually going to be paying? Like, yes, the code exists, it can be categorized and the insurance will cover it, but how much are they actually going to pay for it? Like, how do
Correct.
you get to that?
Correct. So every CPT code, you can go online. You can go online. Anybody can go online if you know what the CPT code is. It's with the CMS physician fee tool, and you can punch in the CPT code, and it'll calculate. It'll show you what CMS reimburses, right? And usually commercial insurances, so CMS is like your Medicare insurance, but your private insurances, your commercial insurances like Blue Cross Blue Shield, they usually pay a little bit more than what CMS is going to be paying. All right. So, yes, there's a huge financial piece to everything that comes out because all of that is taken into consideration from the hospital, the physicians, when they're looking at adopting a new technology that they're going to be using. So, going back to this company that I had invested in, they did not have a clear pathway to reimbursement. Okay, their whole thought, and I didn't think about asking them that. I just assumed, and this is where what they say, like, don't ever assume anything. I assumed that the leadership at that time would have been all about understanding the importance of reimbursement, and I just assumed that, but they weren't. They had decided, nope, we're just going to have expect the hospital to pay for this, basically out of pocket because it's that great of a technology. And I consulted with this company as a consultant and I voiced my concern about it. I even got them linked up with a reimbursement specialist who could try to help them along. And I knew that that was their number one issue. That was going to be their number one issue. And fast forward to about 5 years later, as an investor, I have to get the email from the company that says the company is closing its doors. And it's closing because of lack of reimbursement and because of lack of reimbursement, there wasn't a strategic that was interested in buying them. And you want to talk about being frustrated. It was frustrating as an investor, but I was so frustrated as someone in the industry because I'm like, how could leadership not understand the importance of getting reimbursement? Because they were a company that needed to get their own CPT code, which takes about 2 years. And in this 5 year process, they could have had their CPT code. But that's what happens whenever you don't have effective leadership that truly understands what is needed to move the needle and make sure that there's success for the company. And so that's one failure that I can talk to you about and why I now it's so important to me to ask the important questions and just understand that the people on the leadership team of these companies, they're very solid people and they all have been successful within the startup world themselves.
Right. I mean, yeah, I guess like looking at that, because you're saying for somebody who's trying to make their first investment in the space, looking for somebody first, maybe that's probably not their first rodeo, and that the team look back because everybody has failures in some capacity. Look at those, see where things specifically went wrong, and if that makes sense, if that's just an unfortunate occurrence and it is what it is, or if there's something that directly correlated back to them and their flaws or their weaknesses where they didn't have a strength or somebody else with a strength to come alongside them and help them with that. So I think that's huge, and that's something that obviously I had no clue about that specific component, but it sounds like from the beginning it was obvious that it wasn't going to fall under an existing CPT code, and they just didn't want to allocate time and energy to navigate that.
Yeah, they did. And at the same time, whenever I was looking at the leadership that they were putting in the roles, you had a lot of leadership that had a ton of experience with these large companies like the Medtronics of the world, the Boston Scientifics of the world. But they did not have a lot of experience dealing with startups. And that's a problem because when you're working with a startup company, number one, a CEO at a startup company cannot and should not expect a salary, the same type of salary that a CEO would be getting from a Medtronic or Boston Scientific. So, one of my first red flags, whenever I really started, you know, I wished that I had raised these red flags earlier before I had invested, but I had already invested. And then when they appointed their first CEO, their official CEO, I started looking at the background and it's like this person has they have no experience in the startup world. They have no idea what it takes. They have no idea because when you're a CEO at Medtronic, you don't have to worry about reimbursement the way that a startup company does. You have a whole team of people that are handling all that type of stuff. That's kind of off your plate. If you're a CEO of a small startup company, reimbursement's your baby. I often say the reason why I always liked working for startup companies is because everybody on the team, we all wear each other's hats, meaning the CEO is going to be out doing sales to a degree. We've got to know sales, we've got to know marketing, we've got to know reimbursement, we've got to be in the valleys in every single aspect of that business because there is nobody else. And the same thing with the sales. The salespeople, if you do have any salespeople in your organization as a startup, those people, they have to know marketing inside and out because, we don't have the money to make all these fancy marketing materials that we can just hand out. We really have to be very methodical in how we approach every single aspect of the business. And it's like that for every single person in that startup company. So we all, even though there's titles, everybody is really on the same level. We all have one goal, and that is to make the startup as successful as it can be so that we can get the best exit for our investors. And that is just something that if you bring leadership in and all they have is large company experience, they don't get that. They don't understand that because they've never had to be in those valleys and fight those fights and understand that concept.
Right. And now, so to wrap things up, what I think the most important question, I guess, here is, can anyone invest in medtech, or like what? Like, you don't have to be a doctor. Do you have to be a doctor to
No.
invest? Yeah.
No, and I'm so glad that you're asking that question because that has been the biggest thing in that it has blown my mind, especially over the past like 2 years, is the number of people that don't even realize that they can invest in the medtech space. Okay. And even ones that have like they have these massive 401ks, but they have no idea that they can use that to invest in the medtech space. They think, okay, well, I can invest in real estate, but I never knew that I could invest in medtech. The med tech space is like anything else. The biggest thing is you just got to know where to go to be able to find what opportunities are out there. Getting on LinkedIn and connecting, into the medical world is usually a good way. But there's tons of opportunities. There's tons of absolutely amazing technologies that are coming out that are just game changing in many different industries. And, it's a wonderful time for investors to get into some of this stuff. And you can get in, my advice is that as a first time investor, if you're looking to invest, don't get in at a seed stage. But you also don't want to get in too late in the game either. You want to get in with someone who is in a really, if you could get in a Series A round, that's really good. And the reason is because you're investing at a good price point so that you will make a decent return on your investment for when that company exits. And my advice would be, to look at your 401k and and I'm not giving just a shout out to Madison. I'm saying this as my own, as a person that has done this myself. Look at utilizing your 401k with some of these investments. Number one, it is, when that company sells, it'll be tax deferred or go back into your 401k. And, you can kind of avoid some penalties there with taxes. But it also prevents you from using some of your personal funds that you may want to keep around because you need them for other things. It's a win-win situation. But you absolutely can invest in the medtech space. The majority, to my knowledge, I think I'm invested now in like 15 different companies, and not one of those has, said no, you can't use your 401k investing in it. Um, so I would say that the majority of companies are open to those type of investments. So I would get in. I would get in early around Series A, and yeah, get excited about being a part of the medical community because these technologies that are coming out, you're making history. Some of them you are literally going to be a part of making history, and that's such a cool feeling to know that you very well could end up using one of these technologies yourself. Hopefully, some of them you never will, but it's very likely that someone, either you or someone at some point will be using one of these technologies. And what a cool thing it is that you help supported bring that medical innovation to the world. It's pretty cool.
Yeah, absolutely. I love it. All right. So I really appreciate all that we've talked about here. I think this was incredibly insightful. How can people find more about you or reach out to you and connect with you?
Yeah, so you can find me on LinkedIn. This is terrible, but I don't know what my little LinkedIn thing is. So maybe you can share that with people if anyone.
Sure. Yep. In the show
Uh,
notes. Yep.
I don't know all that stuff. Or my email, which is on my LinkedIn as well, Angela Dotson at BlakeBrookeVentures.com. And and listen, I want your viewers to know too that I want people to be successful. I am happy to share my knowledge if they have a question in general about investing, especially as it relates to using 401k stuff. I'm happy, to share my experience, answer some questions, and share with them some opportunities, not just Dr. Tao's opportunities, but other opportunities that I think that they may be interested in looking at. There's everything from, there's some really cool technologies in the urology space right now, in oncology, in interventional cardiology, so a lot of things. So if they're interested in looking at the med tech space, I'll be happy to be a resource for them.
Awesome. All right. I appreciate it. I appreciate your time today, Angela. It was nice talking with you. And we'll leave it at that. Thanks so much.
Same. Thanks, Ian.